Plasma protein binding, what will happen if the drug is plasma protein bound? Consider this is the blood vessel. Consider this is the blood vessel. Okay. So, and this is albumin or alpha 1 acid protein. To albumin, which drug bind? Acidic drug. Alpha 1 acid glycoprotein, which drug bind? Basic drug will bind. Okay. So consider this is the drug molecule here bound to the drug. What will happen? Is this drug available for metabolism? No. Is it available for action? No. Is it available for excretion? No. It is not available for metabolism, action or excretion. But some free drug will also be there. It will be available for all these. Correct? Free drug will be available for all these. But if someone say plasma concentration of drug is measured, for example, concentration of drug is measured, then what is measured? Only the bound fraction or the free fraction? Bound fraction or free fraction? It includes both bound as well as free portion. Okay. Now, if you see this enlarged, consider this is the albumin to which drug was binding. So drug can be binding to bind to various sites, like same drug can bind to here, or bind to another site, this site or this site. Okay. So binding to plasma protein is non-specific. It can bind at any site. Similarly, at the same site, many drugs can bind. Consider this is one more drug, this is one more drug. Both drugs can bind. So if this drug has more affinity towards this side, so if it will go and bind this will bind this, Y will bind this and it will displace the other drug. So this will result in, this is known as displacement interactions. Plasma protein binding is known for displacement interaction. Okay. Now one more point I forgot to say, as I said, the drug is bound as well as in free form. So if this drug is metabolized or gets excreted, what will happen? Again, drug will be released from this side. Okay. If this get excreted, drug will be released from this side again here. Okay. And it will be removed from this. So what is happening here? Plasma protein is acting as a temporary storage of drug. Okay. We will see one more last thing in plasma protein. What happens if this plasma protein bound drug goes to glomerulus? Consider this is the glomerular tuft and this is glomerulus. What will happen if the drug goes to glomerulus? Okay. Consider this is the glomerulus. So if this is the plasma protein and drug is bound to it, consider this is drug. Okay. It is either bound to it or it may be in the free form. So when blood flows through this glomerular tuft, free form of the drug will get excreted, but that bound to plasma protein will not come. And later this will come around the peritubular capillaries. Okay. So consider this is the peritubular capillaries. Again here also drug will be in, this is plasma protein. Drug can be bound form to plasma protein or it can be in free form. So this drug, if this drug is secreted by tubular secretion, what will happen? Concentration of free drug decreases. If concentration of free drug decreases, the already bound to plasma protein will be released because it acts as temporary storage. Okay. Again from here it will be released. Okay. Again here it will be released. Again this will enter into tubular secretion. Again the drug which was bound to plasma protein will release. again it will be secreted. So what I mean to say is, as the free drug is secreted, more drug is released and more drug will be excreted. So that the renal clearance is much more than the total renal blood flow. This is for drugs which are having plasma protein binding. Okay. Already said, acidic drug bind to albumin, basic drug bind to alpha 1 acid glycoprotein. This has been asked as MCQ. Okay. And drugs will remain restricted to vascular compartment. Remember, all these have been asked as MCQ. Drug remain restricted to vascular compartment. Bound fraction is not available for action, metabolism or excretion. It acts as temporary storage of the drug. It acts as temporary storage. Okay. Temporary storage of drug. And plasma concentration is equal to bound as well as free. We have learned one drug can bind to many site and many drug can bind to one site, which will result in displacement interaction, but the impact is minimal. Why? Because once the drug is displaced, it either gets metabolized or it gets excreted. But the impact is there when if the interaction also inhibits either metabolism or excretion, then it will have a significant impact. Okay. Plasma protein binding of each drug is different. For example, if I take benzodiazepines, diazepam, lorazepam, alprazolam, flurazepam. Diazepam has a plasma protein binding of 99%, lorazepam 90%, alprazolam 70%, and flurazepam 10%. So within class also there is lot of difference with plasma protein binding. So plasma protein binding is specific for drug and it should be remembered. No one can help for that. Okay. I have made a simple mnemonic. Drugs binding to albumin. Acids, acids will bind to albumin protein. Acids bind to albumin protein. Okay. Acids. Which are acids? Barbituric acid, salicylic acid and other NSAIDs, and valproic acid. These acids, okay, bind benzodiazepine. Albumin, A for I will take antibiotics. Which antibiotics I will take? I will take best antibiotics. Okay. Beta lactam, B for beta lactam. Beta lactam, okay. Sulfonamide and tetracycline. Okay. Then acids bind albumin protein, P for phenytoin. Okay. Similarly, drugs binding to alpha 1 acid glycoprotein, the mnemonic which I have made is bases like alpha 1 acid glycoprotein very much. Bases bupivacaine, like lignocaine. Alpha 1 you can say alpha blocker prazosin, because you have said alpha blocker you say beta blocker also, and veripamil, much methadone. If you want to remember furthermore, you can say acids are to var. Okay? Acids are for var, 2 for 2 pyramid, var for warfarin, and at the end remember basically quindies. So basically quindies, quinidine, disoparamide, imipramine. Okay, these all among this has been asked. Tolbutamide has been asked, beta blockers has been asked, and benzodiazepines has been asked, and barbiturates have been asked, and verapamil also. You can remember whole this. You can also remember that these are the acidic drugs. Okay, these are the acidic drugs and these are the basic drugs. If you don't have any mnemonic for acidic and basic drugs. Okay. So what will happen if the drugs are highly plasma protein bound? They cannot be removed by dialysis. But see, in general pharmacology you have to remember there are always exceptions. If I say only lipid soluble drugs cross membrane, there will be some exception. If it is lipid soluble also, then also it won't cross. Water soluble always don't cross plasma membrane, but there will be expression. So in general pharmacology, there is nothing like always or never. So what I said, highly plasma protein bound drug are not useful, cannot be removed by dialysis, but few drugs can be removed, and these include barbiturates, NSAIDs, valproic acid. These are removed by hemodialysis. Okay. Now we will see which drugs are not removed by hemodialysis, like high plasma protein bound acid. In high plasma protein bound, benzodiazepines cannot be removed, verapamil cannot be removed, okay, and beta blockers cannot be removed. And in volume of distribution, I have already said drugs with high volume of distribution cannot be removed by dialysis. Examples were digoxin, which was having 6 liters of 6 liter per kg, and propranolol and morphine, or you can say opioids. Okay. Apart from that, drugs which bind to enzyme irreversibly also cannot be removed by dialysis. Example of irreversible inhibitor, OP poison. So these are the drugs which cannot be removed by dialysis. Okay. Now what will happen in disease conditions? For example, if hypoalbuminemia is there. If hypoalbuminemia is there, plasma protein is low. If plasma protein is low, what will happen? Free drug concentration will be more. So it will, for example, phenytoin toxicity has been resulted in cases of hypoalbuminemia. In uremia, similarly, plasma protein binding capacity is decreased. If the drug will not bind to plasma protein, free drug will increase. Again, example is phenytoin. In pregnancy and inflammatory disease, what will happen? Acute phase reactant, alpha 1 acid glycoprotein is a acute phase reactant. This is increased. So if this is increased, what will happen? Example is propranolol binding is increased. Okay.